Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.
Welcome to St. Louis on the Air. I'm Sarah Fenske. Missouri's new medical marijuana program launches soon, and state regulators are putting the pieces in place for patients to start making purchases. That has physicians pondering their ethical duties and what's truly best for patients. As it turns out, reasonable physicians can disagree on what those duties are. Dr. Mimi Vo and Dr. Mai Vo are sisters. Both are physicians. Both practice in the St. Louis area. But on the subject of medical marijuana, the two Dr. Vos have different perspectives. Big sister Dr. Mimi Vo is part of the Missouri Medical Cannabis Trade Association. She's eager to get things started. And little sister Dr. Mai Vo is a lot more cautious. In fact, she's not ready to sign patients' medical marijuana cards just yet. So we're lucky to have both Dr. Vos in studio today to get both of their perspectives. So Dr. Mimi Vo, welcome to the show.
Thank you so much. Thanks for having us.
And Dr. Mai Vo, welcome.
Hi, thank you.
So Dr. Mimi Vo, you're excited about marijuana's medical possibilities. Why?
Yeah, absolutely. I have seen patients from out of state and patients who live here in St. Louis who have gone to regulated states and purchased medicine and started using it with lots of great effect. And I've got a large panel of patients who've sought me out who are coming to my practice and needing some guidance on dosing and strategies to help with their medical care. And it's been really exciting to see the positive effects.
And you say that they've gotten this for medical conditions. What are some of the ways you've seen your patients use it?
I have a young girl in my practice who's using cannabinoids for her seizures. I have an older patient who's using it for their B-cell lymphoma, as some who are using it for their chronic pain, chronic knee osteoarthritis, or rheumatoid arthritis.
So, Dr. Mai Vo, that all sounds so good. What has you concerned?
I guess my main concern is that at this point, I think research is there and it's ongoing, but it is kind of limited. The other thing that we're taught a lot in medical school is that when you're looking at research and data out there is whether the data is good or it's mediocre. And some of the data, because it's so new, it tends to be a little bit on the weaker side. And so as we are taught in medical school in our training, we use a lot of evidence-based medicine. And I think that's one thing that we could do a little bit better on. And so I have a little bit of reservation. I'm a little bit more conservative. I agree with my sister. Some things we agree on. That definitely there is room for medical marijuana as an antiemetic for patients who are taking, chemo treatments and have like constant chronic nausea that maybe some other medications don't work. Yeah, absolutely. Using that medication, as medical marijuana as a medication would help them. However, another reservation I have is that being that this is controlled state by state and it's not federally legal yet, that do we have a handle on how things are produced and how things are marketed? And so those are my main concerns.
It's interesting. There is a lot of talk about maybe pot is stronger now than it used to be and that different strains have different effects. And yet for a patient, it might not be 100% clear what they're getting. Dr. Mimi Vo, does that give you any concern?
Yeah, the medical cannabis in the past has always been about 5% THC, and as of late, it's probably more 12, 20%. There are concentrates up to 50 to 80% THC. And so that is concerning that, patients may be overdosing or using a little too much and having the negative effects of it. So I think it's very important for patients to be educated. I think that's going to be the most important thing, to really start low, go slow, and read. There's not a lot for patients to learn on their own sometimes. They really have to seek that information, but patients should be starting with 1 to 2 milligrams and ramping up very slowly over a course of 2 to 3 days and moving up on their dose over 3 days at a time.
So as my sister had mentioned, with dosage and whatnot, one of the things that I am concerned about, just because I'm the way way that I've been trained. I'm a nephrologist.
And tell our listeners, what does a nephrologist do?
A nephrologist is a kidney doctor. So I work with patients with chronic kidney disease from the beginning stages all the way to the end where they have end-stage renal disease and they're on dialysis and they need transplants. And, the reason why I think it hits home for me is that, because the research and the data is so new, do we really know how things are metabolized, like the medical marijuana? Do we know that is it completely cleared by the liver? Is there some effect in people or added effect or toxicity in people who have liver disease or kidney disease? So as you can imagine, as we age, our skin ages, right? And I always tell our patients that our organs age as well. Mm-hmm. So maybe liver metabolism's not so good. So, I get it with somebody who's on hospice, on chemo for pain meds, and they're using medical marijuana, but you might have somebody who has some mild liver disease getting some, medical marijuana or some pot to smoke for fun, and maybe there's some toxicity associated with it. So I think that there's room for us to improve in regards to that research.
I would venture to say the toxicity is very minimal, though. That cannabis is metabolized through the cytochrome P450 system. And a lot of times when we see patients having toxicity, it's actually because the P450 system with metabolization not of cannabis, but of the other therapeutics they're on. For example, patients may be on chemotherapies that now those doses may need to be adjusted. And if they have a side effect, it's probably more from that therapeutic and not from the cannabis itself. But I will say that that's a newer area of research that we are exploring. There's a journal called the Cannabis Cannabinoid Research Journal that just had an article a few months ago and just came out very recently where they did a double-blinded 4-way crossover study looking at blood concentrations of THC in patients. And it showed that the peak plasma concentrations of THC were different in men versus women. So yes, this is an area that we do need lots more research on. But then again, what we're seeing is that the stigma, the negative stigma, and the not of being able to research it in the last 70 years has caused this problem today. And patients are not waiting around; they're going to go ahead and get treatment. And
I think this is time for the research to basically explode. I mean, it's coming, and this is going to be it's a wave, right? So every state hopefully will legalize this, and I think it's a really good thing to legalize because eventually, we're going to get it FDA approved the way that any other medicine gets FDA approved and goes through this pipeline of getting money to do research. So I think that's great. One of the things my sister had mentioned about the cytochrome P450 is that absolutely that's a medication or a way that medicine is metabolized. Now, there are a lot of medicines, for example, like warfarin or Coumadin that people take for as a blood thinner. For example, if you have an abnormal heart rhythm like atrial fibrillation, you'll take Coumadin as your cardiologist prescribes to you. Now, the issue is that if the cannabinoids are broken down in that system and that patient buys this medicine, right, medicinal marijuana from a dispensary that does not have a doctor on board or does not consult a doctor, maybe that's a problem because they don't really look at the medications that the patient's on. So I think that eventually when we're hitting the peak of this wave and doctors need to get involved, I think it's really important for doctors to get involved. And I applaud my sister for, being one of the supporters of this because we do need people who stand up and say, hey, I'm okay with this, Eventually, will I be okay with giving people, giving my signature to give people cards? Absolutely. But at this time, we need more information.
And that's where I think with the Missouri Cannabis Trade Association, I've been very helpful is trying to bring this knowledge to doctors. And my sister will say this, we as physicians are taking care of patients, 80 hours a week. We have families to take care of. It's very hard to find time to learn new research when it's not out of our field. I mean, she's a nephrologist. I mean, how much time do you have to read something that's not nephrology related?
You have to stay up to speed on kidneys.
Right, yes,
right.
Yeah. And so I've been traveling the state trying to educate doctors, and I'll be at the Missouri Cannabis conference. It's MoCan BizCon and Expo, March 2nd and 3rd, and we'll be educating doctors there. I have a 1-hour continuing medical education accredited presentation that I give that doctors will be able to go to. And really, any NPR listener who is listening today can get 25% off with the code NPR25. So hope you guys can.
Good little ad right there.
Plug that in. But, that's going to be important to learn, educating doctors in the medical community.
We're talking to Dr. Mimi Vo, who's a supporter of medical marijuana with the Missouri Medical Cannabis Trade Association, and her sister, Dr. Maivo, who's just a little bit more skeptical about some parts of this. Dr. Mimi Vo, I'm wondering, among your colleagues, roughly what percentage do you think are actually knowledgeable about cannabis at this point?
When I go into a room of 30 to 50 physicians, and first question I always ask is, who in here knows what the endocannabinoid system is? Maybe one. Probably.
Really?
Yeah, 0 to 1. Most of the time it's 0. So it's so new. The research, the CP1 receptor was only identified at St. Louis University by Dr. Howlett in 1992. So it's really the last 10 to 20 years where we're learning, understanding what the receptors are or what this cannabinoid system is. So, most of the time it's a no.
It's interesting the way this is working. A lot of us talk about getting a prescription for medical marijuana. I understand that's not actually how this is going to work. There's going to be a certification form that basically says the patient has a qualifying condition. Dr. Mimi Vo, what would a qualifying condition be in this case?
So cancer, epilepsy, chronic pain, patients who might have Crohn's disease, irritable bowel, fibromyalgia. So actually a myriad of illnesses. And the very last one is any chronic medical condition where the clinician believes that medical marijuana may be effective.
So this is going to be a whole number of conditions that probably involve a number of people that Dr. Maivo, you'll be seeing. Do you think you're going to feel some pressure to certify on this form when you have this kind of skepticism about what you'd be certified for?
Yeah, actually, funny that you had mentioned this because I have already in the last probably year have heard this a lot from a lot of my patients. As a nephrologist or a kidney doctor, I work with dialysis patients, and as you can imagine, their quality of life is not that great because at least 3 times a week they're there sitting in a chair, whether they're, crippled or have back pain or whatever. They have a lot of pain. Chronic pain is a huge situation in dialysis patients. So I've had a lot of patients come forward and ask me whether or not I will certify them. And I said, at this point, I am not going to certify anybody. I'm very cautious about it. And, just as I am very cautious with narcotics. And the reason why I'm very cautious with narcotics is because we have this opioid crisis, which I think medical marijuana may help with that. But that's another subject. So, a lot of patients have come forward and asked me about it. And all I say is at this time, I'm not comfortable and I will help you find somebody that
so
could
you
certify.
Might refer them to, say, your sister? Or?
Well, I try not to do in family.
Sure. but someone like her, but not her.
Yeah, so usually I'm asking my sister if she knows anybody that's in the field that could help me with that.
And I applaud SSM and St. Louis University for not tying their doctors' hands behind their backs. There are health systems out there like Mercy Hospital who would said, any physician in the Mercy system is not allowed to certify patients. And I actually I'm a hospitalist as well. I practice internal medicine. So I can practice medicine at Mercy South Hospital and Mercy Hospital. I can practice at both. But that is an issue. So some of these doctors that I've talked to want to certify their patients, but cannot because they're not allowed to.
If someone's just starting from scratch, where would you suggest, Dr. Mimi Vo, where would they go to try to find a physician who might be on board?
I would Google, medical marijuana certification, and you would probably find lots of doctors' names pop up. There are clinics that do just certifications.
People are actively courting these patients right now. Yeah. Unfortunately, we're out of time. I have so many more questions about this sister relationship here, but Dr. Vo and Dr. Vo, thank you so much for joining me today.
Thank you for having us.
This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, saluting Earth Day on April 22nd with an ongoing commitment to help offset carbon emissions with sustainable harvesting of Missouri forests. Details at choosewood.com.